Hello, my name is Dr. Kristen Wright. I'm a reproductive endocrinologist at Boston IVF and the Bedford, New Hampshire office.
And I'm Carleigh Nesbit, also reproductive endocrinologist in Bedford, New Hampshire, at Boston IVF. And we're here to talk to you today about some common fertility myths and misconceptions that we hear about from patients all the time. So hopefully we can shed some light on the truth about these topics. Some people feel like they can get pregnant anytime in their cycle. Some people feel like it's this very specific moment in time. And I was curious, Dr. Ray, how you talk to your patients about that.
Yeah, so the truth is you can only get pregnant during a specific short window in your cycle, and usually in the middle of the cycle. Women typically ovulate 14 days before they get their next menstrual period, and you're most fertile before you ovulate. So having intercourse about every other day in the middle of the cycle will usually give you adequate exposure to sperm. Or if you're using ovulation predictor kits, having intercourse the day that the kit turns positive and the following day are your most fertile days. Infertility is mostly a problem associated with female biology. What do you think about that, Dr. Nesbit?
I hear that all the time, and I'm sure you do too, that I even sometimes have couples who will say, the female patient's so sure it's something that's going on with her. And so she'll say, well, why don't we test me first? Because I'm so sure it's about me, and then we can test my partner later if we don't find anything. But the truth is that there's so many things that can cause fertility challenges on both the male and female side. And actually, there's a lot of cases where there's a contributing factor from the male side too. So it's really important to evaluate all aspects of both partners when you're doing an evaluation.
Absolutely. It can definitely be the male side too, for sure. If you've had a child, some people think that you can't have fertility issues, can't have secondary infertility. What do you think about that?
So that's something I hear all the time too, that people kind of make an assumption that they were able to conceive easily in the past. And so they think that the next time it will also be easy. And for a lot of people it is, but for some couples it's not. And we see people all the time who have trouble conceiving their first baby and then have no problem conceiving their second. And then we see the opposite too all the time. So just because it was easy the first time doesn't guarantee that there's not going to be some trouble the second time. The next myth that we wanted to debunk today was that IVF guarantees pregnancy. What do you think about that, Dr. Ray?
Well, I wish that were the case. IVF has helped millions and millions of people to have their families, but success rates depend on multiple factors. So female age is an important factor that influences success rates. The other things that influence success rates are the underlying cause of infertility, prior pregnancy history, and then what the fertility testing shows, especially the ovarian reserve testing. That's the testing telling us where the female is at in the ovarian aging process. So all of those factors influence success rates with IVF. There's personalized calculators we can use to predict your individual chances of success if you come to see us as a patient. And at Boston IVF, we would tailor our treatment plans to your individual circumstances to try to maximize your chances of having a baby. And then I think the last myth that we have here that we wanted to debunk is that you can only get pregnant through IVF if you have infertility. And is that the only reason to perform IVF? Or is that the only treatment available?
Yeah.
Sorry.
I feel like I hear that all the time from patients, especially because it's in our name, right? So I feel like I have patients all the time who come in and they're sort of afraid that I'm going to tell them they need to do IVF. And the truth is, for most of our patients, there are multiple options available to them. And it's our job to help you figure out what the best option is for you, using the knowledge we have. And there are some couples where we say, I really do think that your best chance at building a family is through IVF, but usually there are other options available too. And to your point, Dr. Wright, there's also reasons we do IVF that are not for couples with infertility. Sometimes we're doing IVF for other reasons, like a couple is at risk of having a child with genetic disease, even though they have no problems conceiving. Sometimes we're doing IVF because somebody's facing a therapy that might harm their reproductive chances, like chemotherapy. So, there are couples with infertility that conceive not using IVF, and there's couples without infertility that need to conceive using IVF. So it gets pretty complicated.
Yeah, agreed. We see lots of patients for lots of different reasons, and so we hope that this has been helpful in debunking some of the myths that are out there about infertility.